Hello and welcome to Rise Unwind. My name is Dan. You know, each and every week I try to talk to people from across the country about things you could do in your neighborhood. And on this week's show, we got this.
Elevated, it feels like they're part of the process. It's made hosting so much easier. Now I don't spend the whole time making drinks.
When I was sent home, I was given 2 to 4 months to live, unbeknownst to myself. And I started to walk.
All of that plus more right here on that show we like to call Rise and Unwind. Imagine waking up in somebody else's body and it's your worst enemy. Swapped follows a tiny woodland creature and a majestic bird who suddenly switch bodies and are forced to work together to survive. It's a fun, fast-moving story, but underneath it all, it really is about empathy, family, and seeing life from a different perspective. The film features a big cast, including Michael B. Jordan and Cedric the Entertainer, who plays a father at the center of it all. Cedric the Entertainer is here with us now. Welcome to the show, my friend. How are you?
All right, good, brother. How you doing, man?
I'm doing great. The story behind this blends comedy with a real message about empathy. What stood out to you when you first read this script?
You know, I mean, I really love the idea of this, father-son kind of relationship. The son is kind of stretching out, trying to, experiment and find a new way in life. And his father that's trying to hold on to the traditions in which we kind of lived by and those things that he felt make them safe and that he do as a father. And I think that, generationally, my real life is dealing with that. My son is that 25-year-old with bigger ideas than I had at 25 and the guts to go and try them sometimes. So you're like, whoa, I don't know if you can do that, right? And so I think that's what I really resonated with me is this idea that the generations after you always push the line a little bit further down the street.
And the whole idea is about literally seeing life from somebody else's point of view. What do you think audiences will take home from that?
I think it's very poignant to the times that we live in, and for all of us to be able to kind of embrace what it would be like to be in someone else's shoes, to be in their particular circumstance, and understand that if I just had an opportunity to see it from that POV, I could be more tolerant, I could be cooler, I could be, more accepting of differences. And I think that that's really important that the youth see this. Of course, that's the energy that the animated movies are about, but the adults who take them to the movies will see it in their own adult way. These kind of themes that I think will allow for a great message, but a great moment of entertainment.
And when this project came your way, what was it about Swap that stood out to you?
I mean, really, I like the storyline of of who this father was. I wanted to, we were expecting to be delivering a lot more comedy, but once I realized it was like a kind of a sincere, discerning role, that was even greater. It was an opportunity to do something that was a little different than what I normally do. So, but I love playing these father characters, but this one was like, again, you understood that the comedy relief was going to come from somewhere else, and I was there to kind of help support the story, and that was great. That's like a different kind of acting skill that you get to use when you kind of like make sure that you're the person that's carrying the plot and keeping the story alive itself.
And being part of a cast like this with voices like Michael B. Jordan and Juno Temple, What was that experience like for you?
I mean, again, another exciting part to do it. I mean, of course, Michael B. Jordan, this was even when we started doing this was pre the hype of Sinners. So we had no idea he was going to become an Oscar winner and all these things. So, but but he was just, a great talent, one that you knew had great potential of being a superstar. And of course, Juno is fun. I love Ted Lasso and her roles, and then Tracy Morgan's one of my great friends. And so, I was just looking forward to having a good time while all being on the same project.
All right, Cedric, thanks for joining us today. You can catch Swapped on Netflix right now. Definitely a fun one to throw on this weekend. Thank you for joining us once again, Cedric.
Thank you. Holla.
There's always that point during summer get-togethers when somebody gets stuck, playing bartender all night instead of actually enjoying the party. This year, one of the trends popping up is flavor matchmaking, pairing simple summer drinks with the mood and setting, even the food, without making things overly complicated. Geoff Dillon is joining us this morning from Dillon's Small Batch Distillers with a few ideas that might make summer hosting maybe a little bit easier. Welcome to the show, Geoff. How are you, my friend?
Thank you for having me. I'm wonderful.
Flavor matchmaking, and it kind of sounds like something people are trying to start pretending they invented this summer, but what does that actually mean?
Well, I think we just invented it, It's a term we're using to describe pairing a drink with a moment. And we're up here in a fruit belt called Niagara, where seasons are a huge deal to us. Summer's coming online, the greenery is out, stuff is blooming. It's a beautiful thing. We really lean heavy and hard into this. Summer, we think of bright flavors like citrus, herbs, berries, and we want to make something special that feels right for that moment.
So what are a couple of flavor combinations that you think instantly feel like summer right now?
For me, we lean on our neighbors. So we were surrounded by fruit orchards and vineyards and greenhouses. This summer, strawberry, rhubarb, and a zested lime. So I've got an amazing strawberry farm 5 kilometers down the road, hundreds of acres of strawberries. They're just incredible. Rhubarb out of our garden this morning, some fresh lime. It's got the sweetness from the strawberry, the tartness from the rhubarb, the acidity from the lime. It's a perfect mix. Great summer cocktail.
And most people want to host without turning into that unpaid catering staff member of their own party. But what are some easy ways to simplify drinks and entertaining?
And this one I have some real experience with. A decade of doing it wrong. As a distiller or a founder of a distillery, people always expected big cocktails, or at least I thought, from me. So I would spend 10 minutes a cocktail. The whole party would be me mixing drinks. I don't do it any longer. I've realized that a good host is a relaxed host. Now I'm building a garnish bar. So I let people garnish their own drinks, come over, pour the cocktail into the drink, keep the drinks chilled, choose their garnishes. It feels elevated. It feels like they're part of the process. It's made hosting so much easier. Now I don't spend the whole time making drinks.
So in your mind, what separates a good summer pairing from one that just feels overthought?
As a distiller, it's always about balance. We want some light sweetness. In the summer, we never want anything too sweet. People don't come back for those. So light sweetness from some natural ingredient, usually fruit. And then we want to balance that out with a lot of bright acidity. So nicely balanced means everything, both in cocktails and in life. We always like to add in a little bit of complexity using maybe an herb or a botanical in there to give you something more to think about. But that's it. It's all about balance here.
All right, Geoff. So where can people go if they want more ideas or maybe some inspirations?
Check us out at our website, dillonsmallbatch.com. We've got a locator there where you can find what retailers are stocking us. Brand new in Florida this year. We're very excited to be down here. And you can learn more about our cocktails.
Geoff Dillon, I really want to thank you for joining me today.
My pleasure.
Kids being tired or picky eaters can seem pretty normal, but doctors say those can sometimes be signs of iron deficiency, something that affects more children than a lot of parents actually realize. Iron plays a major role in growth, energy, and development, and experts say many families didn't recognize the symptoms until they become more serious. Dr. Gabriella Dauer is joining us this morning to clear up some of the myths and explain why parents should watch out for some of these signs. Good to have you, Dr. Dauer. How are you?
Thank you so much for having me on this important topic. Appreciate it.
Okay, how prevalent is iron deficiency in kids right now?
Absolutely. It's actually the most common nutritional deficiency in the world. If you think about it, about 1 in 5 people are probably functioning at subpar iron levels. And when we talk about anemia, low hemoglobin, about a quarter of the world is anemic, and the most common cause is iron deficiency. So we are seeing quite a bit of this as pediatricians and physicians.
So what are some symptoms that can easily be overlooked by parents?
Yeah, iron deficiency can actually exacerbate a lot of health conditions. It affects a lot of different organs. So to start, you're right, it can be pretty subtle. And once parents start to see fatigue, weakness, their kiddos being more pale, having headaches, dizziness, feeling short of breath, that's when they start to think, okay, maybe something's up, maybe something's going on. And those are the early signs and symptoms of iron deficiency.
And we hear a lot of opinions about online supplements, but what are some myths parents should ignore when it comes to iron?
Right. So as a pediatrician and a mom, I hear so many different myths, and we're seeing so much online. And one of the biggest myths that I hear about is that the FDA actually regulates the supplement market. No, they're not really regulated. So you have to trust the science, not this flashy marketing that you're going to see. There's a lot of iron supplements that are out there. Some of them are potentially completely ineffective. So you have to look for clinical trials. Especially for me, I look for external validation. That's what matters to me. So I tell my patients, consult with your doctor, right? Ask us further recommendations. Trust the science.
And can you tell us about Novoferum and who it's really intended for?
Absolutely, yeah. So my kiddos take Novoferum. I recommend it to everyone. They make iron supplements, and it's available for all ages. Obviously, if you have low iron or iron deficiency anemia, you're going to ask your doctor, see if your kiddo or you need to take an iron supplement. But why I love this one, so my kid would not take any because it has GI side effects. It doesn't taste so good, but this one's actually flavored with monk fruit chocolate. He loves the chocolate, and berries. So they'll actually take it. We don't have to fight with them to give them a supplement, and has less GI side effects. So for me, as a mom, that makes it easier on me. And safety profile for me, I want a brand that is going to prioritize safety. It's the only brand on the market for pediatrics that is actually clinically proven to be safe and effective. And they have a multi-year clinical trial. So for me as a scientist, as a physician, that's what I found super important.
All right. So where can people go to learn more?
Yeah, so there's a great website with more information for parents overall, novoferum.com, and you can find their product on their website there, on Amazon, and at retail pharmacies.
Dr. Dauer, I really want to thank you for joining me today.
Thank you so much for having me. Have a wonderful day.
A serious diagnosis could change your entire outlook in an instant. Eric Borstein was once told he had only months to live, and he says focusing on emotional health became just as important as the medical treatment itself. He's joining us for Mental Health Awareness Month to talk about his resilience, support, and finding purpose through recovery. Welcome to the show, Eric. How are you?
I'm great. Thank you for having me.
Okay, when you first got that diagnosis, what do you remember most about the emotional side of it?
Yeah, so 5.5 years ago, I collapsed in the bedroom. I spent 22 minutes unconscious where I was dying. Was brought to Cedars-Sinai Medical Center here in Los Angeles, where I was diagnosed with a very rare heart and lung condition called pulmonary arterial hypertension, a chronic terminal disease, a disease with no cure. When I was sent home, I was given 2 to 4 months to live, unbeknownst to myself. And I started to walk, and I learned that walking helped both mitigate the life-saving medications that I was on, but also helped with positive mental health. It started to make me feel better. Living with a disease like PAH can be very isolating. And that isolation led to depression. And so after I left the hospital, I speak with psychologists once a week, something I still do to this day, a call I don't miss. And I've learned that dealing and addressing your mental health is as important as the life-saving medications that I'm on today.
Thanks for sharing your story. And at some point, you must have realized recovery wasn't just about treatment plans and doctor visits. What pushed you to start focusing more intentionally on your mental and emotional health too?
So I knew the importance of positive mental health prior to being diagnosed, but I was avoiding the issues at hand. I was afraid to find out what was wrong. So post-diagnosis, I knew that dealing with positive mental health was critical. And so, through the process, I've learned that positive mental health is as simple as finding something you love to do. And for me, that's walking. For somebody else, it might be playing the classic guitar, playing chess, swimming. But it's critical. I've learned to, I've developed what I call pieces of my pie. The modern day medicine, good nutrition, exercise, positive mental health in my village. And all of that, is my formula that's worked to this day.
And a lot of families are just trying to balance caregiving, stress, fear, and everyday life all at once. But what advice would you give people trying to support someone through a chronic illness without losing themselves in the process?
Another really valuable lesson that I've learned is reliance of your village. My village is my wife, my kids, my neighbors, my friends, my doctors, my psychologist, and CVS Specialty. CVS Specialty has been there from day one. They had a quorum nurse that was coming to the house. She was just not only life-saving in that she helped, change my bandages and help me with my pump, but she was just another reaffirming voice and reassuring voice to my wife and kids, the caregivers. CVS Specialty provides me my medications once a month, my life-saving medications. And they've also got online support and just added features and added bonuses that I have that have become part of that village. So for anybody dealing with any sort of adversity, I tell people that at some point whether you have or you haven't, you're going to be hit by that proverbial 2x4, whether it's being diagnosed by a disease, dealing with depression, losing a home in a flood or a fire. When you are faced in that adversity, just remember that you're not alone. People do love you, people do care about you, and people are there to support you.
And I love the story about walking becoming part of your routine, because it started small and eventually became part of your identity. How did that evolve into something bigger and more meaningful for you?
Walking has become my identity. I'm a guy throughout Southern California. I now walk about 13 to 15 miles a day, upwards of 5,000 miles a year. About 2 years ago, we started a movement called Where is EB, where we have a fundraiser once a year, and it culminates with me walking from LA to San Diego, 205 miles, raising awareness for this very rare disease that I live with. We also raise money for a nonprofit called Team Phenomenal Hope. And I'm proud to say over the last 2 years, we've raised about $450,000, all to support programs and support research for this disease, and to support programs for patients living around the country who need it most.
And if somebody watching right now is struggling emotionally while dealing with a health challenge, what would you want them to hear?
Really 3 lessons. Number 1, don't avoid your health when something's wrong. It almost cost me my life. Number 2, finding something you love to do will equate to positive mental health. There's other components of that, but really remember that your mental health is critical. It's critical in your journey. It's critical in whatever you're dealing with, whatever chronic illness you're dealing with, or whatever form of adversity. And number 3, just remember you're never alone. Remember that you do have a village for people that care about you. Again, for me, it's my family, it's my friends, it's my community, it's CVS Health.
And if somebody's watching and they want to find out more information, where could they go?
You can go to whereiseb.org, or on social media, you can go to whereiseb on Instagram, or you can go to cvshealth.com.
Eric Borstein, I really want to thank you for joining me today.
I appreciate it. Thank you so much for having me.
Most of us probably don't spend a lot of time thinking about building codes until something goes wrong. But the standards behind the scenes can make a huge difference when it comes to safety, disaster preparedness, and making sure spaces work for everyone. Here's a closer look.
Construction crews across the country are building stronger, safer homes and businesses guided by codes created by the International Code Council, or ICC. May is Building Safety Month, now in its 46th year, highlighting the impact of the ICC and the building codes and professionals behind them. CEO John Belsick says this year's theme, Built to Last, kicks off with simple ways you can get involved.
Building safety starts at home because that's where people spend most of their time. We often see that small issues like overloaded outlets, loose handrails, or blocked exits can turn into serious risks if they're not addressed. Building codes are a commitment to community safety. Many home dangers are preventable. Understanding common household hazards and prioritizing regular maintenance can protect families and their neighbors.
The ICC also highlights the professionals who help put those building codes into practice.
There's a whole network of professionals working behind the scenes, including inspectors, permit technicians, engineers, and code officials, and others. They make sure buildings are safe long before anyone walks through the door. These professionals identify potential risks early and ensure structures meet building codes to protect people every single day.
Another major focus this year is resilience, especially as communities face more severe weather and natural disasters. The ICC says modern codes can help support faster recovery after disaster strikes.
They're designed to reduce damage, protect the people inside, and help communities recover quicker after disasters like hurricanes or wildfires. Investing in modern building codes up front can make a huge difference.
Another important element, designing spaces for everyone to utilize and enjoy.
Communities Without Limits means designing buildings and public spaces that are usable, intuitive, and welcoming for people of all ages and abilities.
The ICC encourages you to get involved and has shareable resources on buildingsafetymonth.org. You can submit proclamations, join local community gatherings, reach out to local representatives to advocate for the latest codes, and more.
National Nurses Week shines a spotlight on the people who keep hospitals and healthcare systems running, but it's also raising new conversations about the safety challenges many healthcare workers face on the job. New research shows workplace violence and security concerns are having a real impact on staffing, operations, and even patient care. Joining us now are John Voight from Memorial Hermann, the Woodlands Medical Center, and Mike Shore from Axon. It's great to have you two on. How are you?
Doing well, thank you.
Thanks for having us.
All right, when we talk about safety in the healthcare setting, what are leaders and frontline workers dealing with right now that maybe the public doesn't always see?
Well, I think that, nurses get up every day and they go to work and they want to provide the best quality care they can in a compassionate way, often at patients and families' most difficult time in their life. I think what they don't expect is to go to work and be assaulted, whether that's verbally or physically. And that is going on more frequently than ever. Back in 2019, there was about 14,000 assaults reported on nursing. And in 2023, it was up to 24,000 assaults. Currently, we're seeing an average of 2 nurses every hour being assaulted in the United States. So that's the unexpected, and that's the thing that we're trying to address now by bringing awareness to it and looking for solutions for those problems.
And John, your background is pretty unique. You got military, law enforcement, now nursing leadership. How does that shape your perspective on workplace safety in healthcare?
Yeah, I think as a police officer and certainly as a military soldier, I think that, the benefit that I had in those professions was that we had lots of training, whether that's basic training or the police academy, who really taught us how to deal with patient populations or populations of people that are less than desirable with their behaviors. And I think that in addition, you were often given weapons to protect yourself. I think nurses go to work every day and with their kindness and compassion, and they weren't given any education about how to do these things. Certainly not in nursing school. And I think that it's impacting them significantly because they're scared to go to work. They have fear of events occurring. And I think we're starting to see an exodus of nursing, whether it's retirees that are retiring early or nurses that are moving to other professions because they're scared of the workplace violence that's going on in the organizations they work.
And we hear a lot about staffing shortages and burnout in healthcare. How much are safety and security concerns really contributing to those challenges?
Well, you raise a great point. I think staffing a hospital is always a challenge, and I think the biggest concern in staffing nurses right now is burnout, and the biggest driver of burnout is workplace violence. And so we hear over and over on engagement surveys and across the country that we need solutions. They want to know that their voice is being heard and that there's going to be solutions for it. An example is flight attendants have federal laws that protect them and keep them from harm. Nurses have nothing other than what exists within the state laws, but not really related to nursing in particular or into healthcare. So I think that, there's a huge point on trying to keep these nurses in the workforce and keep them safe so we don't lose these high quality skilled nurses. I think Mike probably has more on how it affects our finances in healthcare as well.
Yeah, I'll add to that. John does a great job of framing the problem, and the scary stat of 2 nurses are attacked every hour. This has reached a breaking point, and hospital leadership is going beyond not only their moral duty, but this is actually becoming a bottom line issue of the costs associated with staffing, with retention, with insurance and legal costs, and ultimately productivity. That brings us a bit to Axon on where they're investing. 50% of the top 100 hospital systems are now deploying our solutions. We are a 30-year-old technology company built around our mission to protect life and solutions for safety and security. We really started in the security organizations within these hospitals with solutions like body-worn cameras or evidence.com or Fusus, our real-time operations software. And we're now actually evolved our solutions to be built specifically for nurses. And so our Axon Body Mini device provides things like a geolocation around a panic alert, real-time audio and video. And on the back end, the investigation and the reporting all is done in our software in a much more efficient way. One of the additional challenges of every single one of these incidents is the days and weeks of administrative burden that goes into unpacking what occurred and taking the right corrective actions. And that's where Axon's done a lot of work with our partners in healthcare to build solutions specifically for them. And we're thrilled about the results we're seeing, with incidents in some locations dropping by 50%, upwards of 80 to 90%. We've got to equip our nurses for today's context, which unfortunately you're 5 times more likely to be attacked than any other profession. And this is a profession that we've got to take care of.
And for hospitals and healthcare organizations trying to improve things, what does meaningful, effective safety actually look like in practice?
Well, I think when we talk about meaningful safety, that's really the outcome that we're looking for, right? And I think the outcome that nurses are looking for is they want to be safe. They want to be free from fear. They want to be able to go do their work every day in an environment that keeps them safe and protected. I think that's the essence of meaningful safety, right? And finding solutions to help us get there is the best way to do that.
So where can people go if they'd like to learn more?
Axon.com/healthcare is a great resource to better understand the challenges we've discussed this morning, as well as the solutions that hospital systems are implementing to address these challenges. And then before we wrap up, I want to make sure to say thank you to John for joining us today, as well as his 4 million colleagues around the country. I want to say thank you for everything that you do and wish you a happy National Nurses Week.
Hey, I want to thank you too for joining me this morning.
Thank you.
Thanks.
We've all noticed prices climbing over the last few years, but one issue that doesn't always get talked about is how legal system abuse might be affecting the overall cost of living. So joining us now is Lynn McChristain. Thanks for joining us today, Lynn.
Thank you for inviting me.
Okay, so why is legal system abuse becoming such an important part of the conversation around rising costs for Americans?
Well, what legal system abuse is it's raising the cost of goods and services. If it costs more to do business, those costs are reflected on what consumers pay. You know, the cost of lawsuits doesn't just stay in the courtroom. It's something that does filter down through the whole economy. And one of the problems with lawsuit abuse is that it is raising uncertainty, and uncertainty can get expensive. Now, Florida has made some reforms to the lawsuit abuse, and those have been making much difference, big differences for consumers.
So how do lawsuit costs eventually show up in things like grocery prices, insurance premiums, and housing costs?
Well, for one thing, is if a grocery store has to pay more for liability insurance, it has to pay more to insure workers, if it has to pay more for transportation costs, because trucking firms could be, victims of lawsuits. All those costs are increasing the cost of doing business. And that means that it's reflected in what we pay for everything that we do. If a construction company has to increase its amount of insurance because it's worried about lawsuits, that is something that's added to what we pay for home repairs.
And what reforms can make the biggest difference for consumers without limiting legitimate legal claims?
Well, Florida is a model of what to do. So what they have done is a couple of years ago, Florida did institute some legal system abuse. They have limited the amount of frivolous lawsuits. They made changes to the attorney's fees. They changed the statutes of limitations. So it's serving as a model of what's working, and that has really benefited consumers in Florida. And it's serving as a model of what can be done in other states to control those costs.
And where can people go for more information on this topic?
Well, a great resource is the American Property Casualty Insurers Association. Their website is apci.org.
Lynn McChristain, I really want to thank you for joining me today.
Thank you so much for the opportunity. It was my pleasure.
And that is it for Rise Unwind. I want to thank you for tuning in and checking out the show. If you actually want to be on the show, email us. Go to our website. That's riseunwindtv.com. We're on Facebook. We're on Instagram. You can say hi there and check out some of the behind the scenes. Plus, follow our YouTube channel. That is at Rise Unwind. And until next week, we are that show we like to call Rise and Unwind.